Good morning and welcome to Choosing a Medicare Supplement Policy, sponsored by Hoag Hospital and the Hoag Medical Group and Physician Partners. The Hoag Medical Group and Physician Partners are an excellent team of doctors that provide internal medicine, doctors osteopath, family practitioners, and they have a group of over 350 specialists that will treat your needs. My name is Derek Tarvin, and I've had the honor and privilege of working with Hoag Hospital as an outside insurance consultant for over 25 years. We have an office in Costa Mesa. We counsel everybody on Medicare, Medicare options. We can help review your current coverage and compare that to individual Medicare plans. And today we're going over choosing Medicare Supplement Insurance Policy, and we'll be talking about what is Medicare, signing up for Medicare, Medicare Supplements, also known as Medigap, the Medicare Part D prescription drug coverage we'll talk about briefly, extra help, and the different Medicare or Medigap open enrollment periods. So what is Medicare? Medicare, also called Original Medicare, is health insurance for persons age 65 or older, or any of those under any age persons that have end-stage renal disease or Lou Gehrig's disease. Medicare has four different parts. Part A is your inpatient services. Part B is where all your medical and outpatient charges fall under. Part C is what they designate the Medicare Advantage HMO and Medicare Advantage PPOs. And then Part D is considered the prescription drug coverage. And only Medicare Part A and Parts B will show up on your red, white, and blue Medicare card when you receive it. And there's an example there on your screen. So Medicare Part A. Most people do not pay a premium for Part A of Medicare. It was paid by you or spouse through payroll taxes while working. Part A of Medicare helps cover inpatient care in hospitals, skilled level of nursing care in nursing facilities, hospice, limited part home, medically necessary home health care, and more. Part B of Medicare is where all your medical and outpatient charges fall under. Currently this year, the standard premium for Part B of Medicare is $148.50 per month. Most people do pay a premium for Part B of Medicare. The premium for Part B of Medicare can actually be higher because they depended on your income. The premium for Medicare is deducted from your Social Security check automatically if you're receiving that. Otherwise, they'll bill you by mail quarterly until if and when you start drawing Social Security. And at that time, they'll start drafting it monthly automatically. Part B of Medicare helps cover medically necessary doctor services, outpatient care, tests, durable medical equipment, limited home health care, preventive services, and more. Unfortunately, those that are higher Medicare income beneficiaries, you will pay more for your Part B of Medicare. It's called IRMA, or Income Related Monthly Adjustment Amount. The way Social Security determines what your Medicare premiums are is based on your income on your tax returns. And they always look back 2 years as your modified adjusted gross. And in 2019, if your modified adjusted gross as an individual filer was less than $88,000, you'll pay the standard Medicare premium. Those that file a joint tax return and your modified adjusted gross was less than $176, you'll pay the standard Medicare premium. But if it's higher than that, based on 2 years' income, you'll pay more for your Part B. And the different levels that you can pay are on your screen, and they can go on as high as this. And then Social Security, they audit it every single year. So your Medicare premiums can go up or down based upon your filings. And if you retire or a couple years earlier, you cashed an annuity or sold a property, and it was an anomaly, and they're basing it on 2 years previously, and your income has gone down, and they're charging more for your Part B, give Social Security a call and appeal it and discuss your current financial status, and most likely they'll lower your Medicare premiums based on your current status. Otherwise, they will automatically audit it each year. So signing up for Medicare. Medicare usually starts on the first day of the month that you turn age 65. If you're receiving Social Security or railroad retirement benefits, you'll automatically get your Medicare card in the mail 3 months before your 65th birthday or the 25th month of disability benefits. If you're in these situations and you do not receive your Medicare card in the mail, give Social Security a call. The number for the main Social Security is on the screen. If you're going to call them this time of year, I would call your local Social Security office because it can be a lengthy wait time calling the main number. Once you do get a hold of them, Social Security, they're very helpful, very friendly, and very knowledgeable. If you're not receiving Social Security or Railroad retirement benefits, you actually must sign up with Social Security to get your Medicare card. And there's a couple ways you can do that. You can call Social Security and they'll set up a future telephone appointment for you, or you can go to ssa.gov, Social Security's website, and on their homepage to the right, you click on Medicare and it'll take you to another page. You scroll down to the bottom and it says enroll in Medicare only, and you just follow the steps. It takes about 10 or 15 minutes. If you're going to enroll online, you have any issues or need to talk to them, feel free and give them a call, and they're very helpful. There is an initial enrollment period for signing up for original Medicare. You can sign up for Medicare 3 months before the month you turn age 65, which includes your birthday month, up to 3 months after your birthday month. If you sign up 3 months before your birthday month, Medicare will start on the first day of the month that you turn 65. Unless your birthday falls on the 1st, then you're actually eligible for Medicare 1 month earlier than turning 65. But typically, Medicare, you're eligible the first day of the month that you turn 65 for the 25th month of receiving disability benefits. If you sign up 3 months before your birthday month, Medicare will start on the first day of your month of your birthday, 65th birthday. If you sign up during your birthday month or within 3 months after your birthday month, Medicare will start 1 to 3 months after signing up. There's a general enrollment period for those that missed the initial enrollment period, and this occurs every January 1st through March 31st. If you do not sign up for Medicare during initial enrollment period, you can sign up between January 1st to March 31st each year. And coverage will start on July 1st, and you may incur a late penalty. There are other situations where those that are covered by employer-sponsored group health plan where you can delay signing up for Medicare. If you're covered by an employer-sponsored group health plan and it's based on current employment with 20 or more employees, you can actually delay signing up for Medicare Parts A and or Part B with no penalty. However, when employment ends or the group coverage ends, whichever happens first, you have 8 months to enroll with Social Security for Medicare for A and B with no penalty. So again, if you're working, you're covered by the employee-sponsored group health coverage, there's more than 20 employees, you can go ahead and delay Medicare Parts A and Part B until either the employment ends or the group coverage ends, and then you have 8 months to enroll into Medicare with no penalty. Most people are going to coordinate their individual Medicare to start the day after the group coverage terminates. But if you miss that window, initial enrollment after employment ends or group coverage ends, then you do still have 8 months to enroll for Medicare with no penalty. So oftentimes those that are working with 20 employees and covered under group insurance, oftentimes you will sign up for Part A of Medicare only and delay Part B. There's no premium for Part A of Medicare, so it's just more formality. But if you're working covered by the group insurance as more than 20 employees, you can sign up for Part A and delay Part B until such time as necessary. If there's less than 20 employees, you're working covered under group insurance, typically Medicare becomes primary at that point, so you want to enroll into Medicare A and B. But if you're covered under group insurance, currently active employment, and there's more than 20 employees, you can go ahead and delay Medicare Parts A and or Part B with no penalty. Again, however, once employment ends or group insurance ends, you've got 8 months to enroll into Part B with no penalty. Those that have Part A and do need to enroll into Part B in the future, there's actually 2 forms that would need to be filled out. One form you fill out, one form you and your employer fill out. You submit those to Social Security and they'll enroll into Part B when such time as necessary. So if you have Part A of Medicare only and you need to enroll into Part B, again, there's 2 forms that would need to be filled out. One you fill out, one you and your employer fill out, and you submit those to Social Security and then they enroll into Part B. Those that have a health savings account contribution by the employer and you're eligible for Medicare, it's still working with more than 20 employees, most likely you're going to want to delay enrolling into Part A of Medicare because it can have an impact on your taxes. So if you're eligible for Medicare, still working and receiving a health savings account contribution, most likely you'll want to delay Medicare A and definitely Part B. But always check with your benefits advisor, human resources, see how Medicare coordinates with your group insurance. Those that are covered by COBRA, this is kind of a tricky one. COBRA is a continuation of your group employment insurance coverage once employment is ended. And COBRA can run a term of 18 to 36 months. And if you are eligible for Medicare and receiving COBRA, make sure you enroll into Medicare A and B within 8 months being eligible for Medicare, because they'll penalize you otherwise. So even though COBRA is a continuation of your group insurance, once employment is ended, it meets one of the two criteria. Either group coverage is ended or employment is ended. And again, COBRA can run a term of 18 to 36 months. So if you're eligible for Medicare and receiving COBRA, make sure you sign up for Medicare within 8 months so you don't get a penalty. And oftentimes COBRA can be very expensive. So it's a good idea to review what the premiums for COBRA will be versus the individual coverage for Medicare, and it may be quite a difference in premiums. So always check to see what the individual coverage for Medicare will be when you're eligible for COBRA. But make sure you do enroll in the Medicare within 8 months being eligible for Medicare if you are receiving COBRA. So now we're going to discuss the Medicare supplements, also known as Medigap. They're synonymous. Currently, there's 10 standardized plans that are available, and all the Medicare supplement plans or Medigap are denoted by letters. They range from A as in apple to N as in Nancy. And the Medicare supplements or Medigap plans, they actually supplement original Medicare and pay secondary to Medicare. With the Medicare supplements, you can choose any doctor, any specialist, any hospital or facility nationwide that accepts Medicare patients. Referrals are not required to see specialists, and prior authorizations and approvals are not required. And as I mentioned, the Medicare supplements or Medigaps range from plans A through N, and they're all standardized Medicare supplement plans that are offered and sold by various insurance companies. So any companies that offer the same Medicare supplements, such as Plan F or Plan G, they have identical medical benefits. You can access all the same doctors, and they all pay the same claims. It's just different companies will charge different premiums for the same standardized Medicare supplement plans. So you do pay a premium for your Part B of Medicare. You will have a premium for your Medicare supplement. And the Medicare supplement plans are what they call guaranteed renewable for life. The benefits can never be changed and the policy cannot ever be canceled other than non-payment of premium. So the Medicare supplement plans, they can never cancel it or change the benefits. The only reason they'll cancel it is if the premium's not paid or you switch to a different company. The Part D drug coverage with the Medicare supplements is not included, so you actually must purchase a standalone Part D drug plan for your medications that you fill the pharmacy or mail order. Medicare and the supplements will cover medications that are administered in a facility by a provider, but the drugs you fill the pharmacy or mail order with the Medicare supplements always fall under a separate Part D drug plan, which is the third premium involved. So now we're going to discuss the benefits of the various Medicare supplement plans. And on your screen, and here, this is the Medicare supplement comparison chart. And we can get one of these to you. We can email it to you. You can contact myself or Hoag Hospital, and we'll be glad to email you or mail you a copy of this. So now we're going to go over the various Medicare supplements and what original Medicare covers. So on the left of your chart there on your screen, these are the two parts of original Medicare, Part A and Part B. And original Medicare, it has certain deductibles, co-payments, and co-insurance that it doesn't cover, and that's where these plans come in. They're designed to supplement Medicare or fill in the gaps. That's how they get their names. And again, these are the 10 standardized Medicare supplement plans you can choose from. The most comprehensive coverage, the highest coverage, is considered Plan F as in Frank. But unfortunately, not everybody is still eligible for Plan F. On the bottom of your chart there on the left, on the right, if your Medicare Part A started after January of 2020, then you're not eligible for any Plan F or Plan G. But don't worry, Plan G, which we'll go over as well, is almost identical to Plan F. So if you're not eligible for Plan F, don't worry, because you are eligible for Plan G. So we'll discuss the variance between Plan F and Plan G and what the original Medicare covers and doesn't cover. So if you're hospitalized as an inpatient, your Part A of Medicare is going to cover this hospital deductible of $1,484. And if you follow the chart over, there's two variants of Plan F and two variants of Plan G. The two variants of Plan F have identical medical coverage, the same doctor access, and the same claims payment. It's just with the extra or innovative F, they have routine vision and hearing benefits that the traditional F doesn't cover. And with Plan G, the traditional Plan G and extra or innovative Plan G, again, those two plans, Gs, have identical medical coverage, same doctor access, same claims payment. It's just with the extra G or innovative G, they do have routine vision and hearing benefits that the traditional G doesn't cover. And the extra G has one extra bell and whistle. They cover over-the-counter items. I believe they give a $100 benefit towards over-the-counter items. It's a mail order program that you choose from a catalog, and they mail them out to you. But again, as far as the medical benefits, and as we mentioned, if you're hospitalized as an inpatient, to the top left of your chart under Part A of Medicare, Medicare Part A will cover all of your inpatient charges except this deductible of $1,484. And Plan F and Plan G cover that hospital deductible each and every time. This inpatient Part A hospital deductible could actually be met more than once in a calendar year. If you're admitted to the hospital and then you're released and you're out of the hospital a period of 60 consecutive days or more than readmitted, then Medicare requires a new hospital Part A deductible, or new benefit period as they call it. But Plan F and Plan G will cover that hospital deductible each and every time, so you don't have to worry about it. Besides inpatient hospitalizations under Part A of Medicare, fall skilled nursing facilities. If you're in the hospital for a period of 3 days or more, and then you're released into a skilled nursing facility, and you're receiving some type of physical therapy, speech therapy, drug therapy, occupational therapy, and your condition's improving and you're responding to the treatment, that's what they consider skilled nursing. And Medicare covers the first 20 days 100%. If you're still in the skilled nursing facility for days 21 through 100, Medicare covers but a copayment of $185.50 per day for days 21 through 100. And Plan F and Plan G pick up those additional skilled nursing facilities for days 21 through 100. And if you're released from a skilled nursing facility and you're out of the facility for 60 consecutive days or more than readmitted, these 100 days of skilled nursing will start over. And then the last benefit in our Part A would be hospice care. It pays into copayments or co-insurance towards that level of care for Plan F and Plan G. Now, even if you're in the hospital or skilled nursing facility, or any of your outpatient or medical charges always fall under Part B. That's all your doctor visits, specialists, lab, x-ray, diagnostics, MRIs, PET scans, CAT scans, chemotherapy, radiation therapy, dialysis, ER, ambulance, your surgeons, assistant surgeons, radiologists, pathologists, anesthesiologists, your outpatient occupational physical speech therapy, durable medical equipment, doctor visits in the hospital, preventive services, or medications that are administered in a facility by a provider fall under Part B. It's just the drugs that you fill at the pharmacy or mail order always fall under a separate Part D drug plan, which we'll talk about a little bit in the presentation. So Part B of Medicare covers 80% of the Medicare approved amount, because the providers will bill one amount. They send the claim off to Medicare initially. Medicare usually lowers that fee and they pay their Medicare approved amount. Part B will cover 80% of your Medicare approved charges, and Plan F and Plan G pick up the remaining 20%. And then below Plan F and Plan G here, where it says excess charges paid 100%. So Plan F and Plan G will cover excess charges 100%. And what they mean by excess charges is any providers take Medicare, they may or may not take what's called assignment. If the providers that take Medicare accept assignment, they don't charge above what Medicare approves. They take that as payment in full. But if the providers want to get paid a little bit more than what Medicare approves, they will not take what's called assignment. So those providers that take Medicare that do not take assignment, they'll charge 15% above what Medicare approves. And that amount that providers charge above what Medicare approves if they don't take assignment is called excess charges. And Plan F and Plan G cover the excess charges 100%. So you don't need to worry if they take assignment or not. You want to make sure to take Medicare, because Medicare is your primary insurance. And if they don't take Medicare, period, you want to find a different provider. And then the first time this year you had any medical services, there's a nominal Part B as in boy deductible of $203. That Plan F covers that Part B deductible of $203, and Plan G, you pay that. That's the only difference between the medical benefits between Plan F and Plan G, is this nominal Part B as in boy deductible, that Plan F pays that Part B deductible, and Plan G, you pay that. So with Plan G, after that small deductible this year of $203 is covered, you're covered 100% for any Medicare approved charge. So Plan F is full coverage, and Plan G is virtually full coverage, just this minor deductible that you pay. So they're the most comprehensive plans available. And if you have some more questions about the supplements, we can definitely help answer those questions after the presentation, or you can email me and I'll be glad to go over your questions from them. So as we mentioned, some companies have Medicare Supplement Plan F or Plan F Extra. The Plan F Medicare Supplement Traditional and the Plan F Extra have identical medical coverage. It's just with the F Extra, it does have routine vision and hearing benefits. And then Plan G, as we mentioned, there's two variants. There's the traditional Plan G and there's an extra Plan G, or innovative Plan G, that does have the routine vision and hearing benefits. And the extra Plan G has the one additional bell and whistle, where they cover over-the-counter items, a $100 benefit per quarter. Oh, I forgot to mention too, the supplements also have another benefit called the Silver Sneakers. Most of the supplemental companies offer it. It's basically a free gym membership. There's no restriction on time or equipment. They cover 24-hour fitness, LA Fitness, YMCAs, Curves, a lot of independent centers as well. And you're not restricted to any of them. You go to any of the particular facilities, so it's a nice extra benefit that they have. And we mentioned Plan G. There's two variants of Plan G. There's a traditional Plan G, and then there's the extra or innovative Plan G. And the extra G, innovative Plan G, and traditional G all have the same medical benefits, same doctor access, same claims payment. It's just with the extra or innovative G, they do have routine vision and hearing benefits and the over-the-counter benefit with the G Extra. So we're going to briefly discuss Medicare Part D. This is where all your medications that you fill the pharmacist or mailer will fall under with the Medicare supplement plans. The Medicare Part D drug coverage is available to everyone that has Medicare Parts A and or Part B. With the Medicare supplement plans, you must have Medicare A and be enrolled in Part B of Medicare and paying your Part B premiums. But with the Part D drug plans, you only need to have Part A and or Part B for the drug coverage. Medicare itself does not sell the Part D drug plans. If you have a Medicare Supplement or Medigap plan and want drug coverage, as we mentioned, you must enroll in a standalone Part D drug plan. And they are sold by various insurance companies. The Part D all has the same coverage model. This year, there's 32 different Part D drug plans you can choose from. Next year, there's 25. So each year, there's a different number of plans that are offered. All the Part D drug plans have different premiums, different formularies that they tier your medications under, and they all don't cover the same medications or cover them as cost effective as one other one may be. How we make a registry for a drug plan is we input one's medications and get a line-by-line itemization of all the drug plans and list them from which plan is least out-of-pocket and which is highest. We highly recommend either yourself doing analysis or having someone like us do it, because there can be a wide variant of what you pay for your medications between the various Part D drug plans. Unfortunately, those that are higher income Medicare beneficiaries and pay more for your Part B of Medicare, you also will pay more for your Part D drug plan. 2 years previously, they look at your tax return, your modified adjusted gross. So this year for 21, they look at your 19 tax return. Next year, they look at 20 tax return and so forth. And those that file individually, and 2 years ago, your modified adjusted gross was less than $88,000, the charge is the standard Medicare premium of $148.50. And those that file a joint tax return, and 2 years ago, it was less than $176, will pay the standard Part D premiums, and also Part B premiums. But if it's higher than that 2 years ago, they will charge that IRMA, or income-related monthly adjustment amount, to your Part B and also your Part D drug coverage. And the different amounts that they can charge you based on your income are on your screen, and they can go as high as this on the bottom of the screen. But make sure you do an analysis, or have someone like us do an analysis for the Part D drug plans, because it can vary wildly on what company 1 through company 32 will pay for your current medications. There is a late enrollment penalty if you are late enrolling to a Part D drug plan. If you delay enrolling in a Part D or have a break in continuous drug coverage for 63 days or more and don't have what they call other credible coverage, when you enroll in a Part D drug plan, a late enrollment penalty will be added to your Part D premium for life. It's not a big penalty, it's more of a nuisance. The penalty is 1% of the national base average premium for Part D drug coverage for every month that you were eligible for it and didn't have it. So the national average premium is around $35. So let's say you go 24 months without enrolling in a Part D drug plan and have no other credible coverage. They'll assess a 24% penalty of $35, just around like $8.40, that will be tacked onto your premium for whatever drug plan that you have. So it's always a good idea to enroll in a drug plan, even if you're not taking medications, just so you have the drug coverage in case you need it and don't get penalized for enrolling late. And those that are not taking medications, we would just recommend one of the lower cost premium plans. Next year, the lowest Part D premium, which is the lowest, is I think $7.50. There's one that's like $10 and change, and then they just go up in cost from there. Extra Help, this is a Medicare program that helps people with limited income and resources pay for Medicare drug costs, also called limited income subsidy. It can help pay your monthly plan premiums, deductibles, co-insurance, or co-payments. If you think you qualify, give Social Security a call and discuss your current status with them. So there are various Medicare open enrollment periods that you can apply and not have to answer any health questions. There's like 16 to 17 what they call different guaranteed issue scenarios where you do not have to answer health questions to enroll in a Medicare supplement plan. And we're going to go over the most popular ones. Turning 65 or new to Medicare, those that are leaving employer-sponsored group health plan, a birthday open enrollment, and a 12-month trial right. So those that are turning 65 or new to Medicare, to enroll in a Medicare supplement, you have guaranteed issue where they do not ask any health questions for 3 months before your Medicare goes into effect, the month of, and up to 6 months after your Part B goes into effect. To enroll in a Medicare supplement, you actually must, again, be enrolled in Medicare Part A and or Part B. And if you're new to Part B, you have 3 months before eligibility for Part B starts, the month of, and 6 months after to enroll in a Medicare supplement with no health questions. Those that are leaving employer-sponsored group health coverage and you want to enroll into a Medicare supplement plan, you have guaranteed issue of 63 days once the group plan coverage terminates. If you're new to Part B of Medicare, then you have 6 months. But if you're leaving employer-sponsored group health coverage and your Medicare A and B has been in effect for years, you do have 63 days to enroll into a Medicare supplement with no health questions. If you're new to Part B of Medicare, then you have 6 months after your group coverage ends. Most people are going to coordinate their individual coverage to start the day after your group insurance terminates. But if you do miss that window, that first day after your group insurance terminates, you do have this window of 63 days after it terminates to enroll into a Medicare supplement with no health questions, unless you're new to Part B. Then you have 6 months. There's a birthday open enrollment, and it's in your Medicare supplement. I forgot to mention this earlier. On the bottom left of your chart, there is a time frame that if you have a Medicare supplement plan, you can switch it to a different company that has equal or lesser coverage during your birthday month, every anniversary on your birthday. You have 30 days before your birthday, up to 60 days after, if you have a Medicare supplement in force, to switch to a different company that has equal or lesser coverage. So you're never locked into a Medicare supplement plan or company for life. If you're healthy, and can pass the health questions no, you can switch your Medicare supplement anytime during the year. But if you have a Medicare supplement and you have health conditions or later on develop them, every year on your birthday, you have a 30-day window before your birthday, up to 60 days after, to where you can switch to a different company that has equal or lesser coverage. We always recommend just enrolling in the company that's got the lower premium, because all the Medicare supplement plans are standardized. So with Plan F or Plan G, as far as the medical benefits are concerned, you don't get anything more or less by paying anything more or less, because they're all standardized plans. So if you do enroll in Medicare supplement and later on Company Z is a more attractive premium, you have health conditions or later on develop them, every year on your birthday, you can switch to a different company that's got equal or lesser coverage. The premiums, unfortunately, the Medicare supplements that we would look at today are not set in stone. Not only do the supplemental companies have attained age increases, they increase everybody's rates periodically. So every few years, it's a good idea to look at your Medicare supplement premium and compare that to other companies, and there may be a better rate based on your plan. And you can always switch during your birthday with no health questions. This is a pretty recent new trial right that you can switch your Medicare supplement plan. If you happen to enroll into a Medicare Advantage plan when you first turn 65 and new to Medicare, whether it's a Medicare Advantage HMO or Medicare Advantage PPO, you have 12 months to try the Advantage plan out. So again, if you're new to Medicare, turn 65 and enroll in an Advantage plan initially, you have 12 months to try out the Advantage plan. If you're not happy with it, you can terminate the Advantage plan anytime during the initial 12 months and enroll into a Medicare supplement and a drug plan with no health questions. Those that do have a Medicare supplement plan and have never enrolled into a Medicare Advantage plan, if you enroll into a Medicare Advantage plan coming out of a Medicare supplement for the very first time, they will also give you a 12-month trial basis. So if you have a Medicare supplement and decide to try a Medicare Advantage plan for the first time, they'll give you 12 months to try the Advantage plan out. If for any reason during the initial 12 months you're not happy with the Advantage plan or simply want to get your Medicare supplement back for whatever reason, you can terminate the Advantage plan anytime in the initial 12 months, enroll in your Medicare supplement, get it back from the same company, and a drug plan with no health questions. They don't give you both 12-month trial basis, they give you one or the other, but it's nice that they give those to you. If you stay with the Advantage plan past the initial 12 months, then they're going to lock you into the Advantage plan for that calendar year, and you may be subject to health questions going to a supplement at that time. There's another one if you move out of the county or the state. It's not on your screen, but if you have a Medicare supplement or Advantage plan and you move out of the county or the state, you have an enrollment period, a special enrollment period to where you can switch to whatever plan is in that area that you move to, whether it's a Medicare supplement or a Medicare Advantage plan. The Medicare supplement plans are good nationwide, so we do have clients that moved here from Orange County to other states and they kept their policy. If you have a Medicare supplement and you move, I would always check out what's available in that area, what the premiums are. If it's similar coverage, it's a better rate, I would enroll with a plan where you move to. Otherwise, you can keep your Medicare supplement wherever you go throughout the United States. And this is a really new one. This is called the Medicare Advantage Open Enrollment Period. Not very many people know about this time frame. They can't advertise it or target anybody. But between January 1st and March 31st, you can disenroll from a Medicare Advantage plan and return to original Medicare A and B, apply for a Medicare supplement, and enroll into a Medicare Part D drug plan. If you're going to use this time frame to terminate the Advantage plan and apply for Medicare supplement, we highly recommend applying for the Medicare supplement before enrolling into a drug plan because you may be subject to health questions and they could deny your coverage, and we don't ever want to leave anybody without insurance. So you have a Medicare Advantage plan and you want to go back to original Medicare between this time frame of January 1st to March 31st, make sure you apply for the Medicare supplement before enrolling to a drug plan. If you enroll into a drug plan, a Part D drug plan, it will automatically cancel your Advantage plan out the following month. So if you enroll in a Part D drug plan in January, it'll cancel your Advantage plan in February, March, it'll cancel in April. And again, we don't ever want to leave anybody out of insurance. So if you're going to use this time frame, make sure you apply for the Medicare supplement and that they accept you before enrolling to a Part D drug plan, because again, that will automatically cancel your existing Medicare Advantage out the following month. I know we went over a lot of information. We'll be taking some questions now. If we don't answer your question in detail, you'd like some more information, please contact me in my office. You can give us a call or send us an email. This question is a Medicare Advantage plan usually more robust than other plans? I'm assuming that you mean there's additional benefits with the Medicare Advantage plan. Most of the Medicare Advantage plans will have vision and hearing in the benefits and offer some type of dental coverage. Some do offer transportation. One will throw in a Fitbit if you request one. But typically the Medicare Advantage plans will have some additional benefits than the Medicare Supplement plans do. The Medicare Supplement Plan F does have the additional vision and hearing benefits and co-payments for hearing aids. The Extra G plan does have vision and hearing benefits and the over-the-counter benefit for the mail order program. So the Advantage plans do usually have the additional benefits and would be more robust in words than a Medicare Supplement plan would be. But always check out the benefits between the Medicare Advantage plans, whether it's an HMO or PPO, and compare those to the Medicare Supplement plans. And I think that's our only question today. You must have been a very attentive crowd. We thank you for joining us. Please give me a call or email, and we'd be glad to hear from you. You guys have a great weekend and have a nice Christmas. Thank you.